UnitedHealth Group is under criminal investigation for possible Medicare fraud. There have been lots of noise around Medicare, lots of noise around Medicare Advantage. Just to give us an idea, you're talking about over half the beneficiaries on Medicare have a Medicare Advantage plan. Here's the article. It talks about how risk coding, some other strange words here that are introduced to newcomers to Medicare. It's enormous. More than half of all people on Medicare, which basically means that about 35 million people are on Medicare Advantage as Medicare Advantage plan members. If you're part of a retiree group plan, it is usually a group Medicare Advantage plan. Every autumn, doesn't matter. You can't avoid it. Commercials left, right, and center about Medicare Advantage. I'm going to talk about UnitedHealth Group. I'm a licensed agent. I represent UnitedHealth Group on both Medicare Advantage plans, Part D plans, as well as Medigap, otherwise known as Medicare supplements. It is investigating UnitedHealth Group for possible criminal Medicare fraud, Medicare Advantage business practices. Now, that's vague. That said, we can attach some kind of preliminary possible reasons. We've talked about it here on Jay's Corner. We've talked about it on Maximizing Medicare, the other YouTube channel that I run. For people who do not know, who are newcomers here, I'm the author of the published book, Maximize Your Medicare. As certified financial planner, which also includes being Medicare expert and representing companies, I have a particular set of insight when it comes to Medicare as well as financial matters. If we take a look at the stock, you will see a tremendous drop. Year to date, a precipitous drop. This is a high of $600 down to $274, more than a 50% decline since January. I find that most of targeting of health insurance carriers to be a little odd, because ultimately UnitedHealthcare and the other large carriers and small carriers, they're dealing with inputs. I try to explain people about the fundamental misunderstanding about what insurance is and how the prices are created. Orange juice does not create the price of raw oranges. It's the other way around, meaning that a raw orange, if the price increased by 50%, then of course the orange juice would increase in price. Also, if oranges dropped by 50%, then you would fully expect orange juice to drop in price. That is obvious and just common sense, but it just goes to show you that how complicated health insurance is and healthcare, that the terminology of money is all mixed up. I've devoted the entire of Jay's Corner here, which is the newsletter. Please subscribe to it, jo.substack.com. And you can see it right up here. I've titled it this way, because what ends up happening is when you have the wrong idea and you mix up terms, then you get pulled off the track, and now you're assigning blame and you're assigning false credit, false blame, which is, the United States, our most popular, pastime. And this entire newsletter is about different aspects here. And it kind of goes back to the fact that money has a naming problem, and then philosophy and your politics then also intervene. They get stirred up into a soup, and it becomes unsavory. Let's just leave it that way. Let's go back to UnitedHealthcare. So you're talking about kickbacks that trigger higher Medicare or Medicaid payments. Some of the talk here has to do with the risk coding. So for newcomers, risk coding is basically that if you're Mr. Sick a lot and you are a Medicare Advantage plan member, then the carrier gets paid a higher allowance, basically. This allowance depends entirely on the health assessment of Mr. Sick-A-Lot. The issue here is, let's say you're Miss Perfect. If you're Miss Perfect and we tell the government that you're not Miss Perfect, but yet you're Miss Sick-A-Lot, then the carrier gets extra money. This entire process here I have found odd, to be very candid with you, that it is full of leakage, loopholes. It's a gateway from which carriers can take advantage if they are focused only on getting the higher amounts of money. Now, the reason I don't sit there and just say they shouldn't do this and that's bad and they should be thrown, I stop all of that. And there's a reason. The reason is that extra money, those extra monies, right, are being used to also create other benefits that people, the general population of Medicare Advantage plan members, that they do enjoy and use and find necessary. For example, original Medicare does not include dental and vision. Pretty much all Medicare Advantage plans have added these extra benefits inside these plans. Where do you think the money came from? The money came from the fact that they get this allowance, whatever that level is, and they allocate across all of these different types of benefits: dental and vision, health club membership, OTC card. These extra benefits here come from the allowance. So as a result, this is not just a one-way street. This is not just the situation where, okay, they have this extra money and they're just putting it into their pocket. No. The Department of Justice thinks differently here, which is they clearly, if true, and there's no reason to doubt that the Wall Street Journal is reporting the truth, right? It's just not likely that this is like a false story, right? The Wall Street Journal, highly reputable publication. That the Wall Street Journal, the unit focused on busting doctors, and this is what the enforcement has been. And you can read this in the headlines kind of spectacularly, which is that healthcare providers are saying that you need skilled nursing facility care. They don't when they don't. And then the skilled nursing facility then bills Medicare and Medicare pays them, etc. That type of process, that type of headline exists. Okay. This is the first time that the largest of carriers is focused on a criminal way. If you are not a follower, you wouldn't know this, which is that individual carriers have settled this type of allegation with the CMS. They've settled these allegations. They have settled these allegations, the obvious agreement of saying there's no wrongdoing admitted. For example, Medicare Advantage are paid extra for covering sicker patients. That's exactly what I just said about Mr. Sick-A-Lot. And now they're also revealing this: creating incentive to document diagnosis for patients they cover. So this has to do with the Miss Perfect. So this question is whether or not those diagnoses, right? So now we've got Miss Perfect. We called her actually Miss Kinda Sick. When the carrier gets extra money, this extra money is the point of criminal activity. That is what this article seems to be reporting about the Department of Justice. I can tell you, as a person who has no problem in advocating our clients towards Medicare Advantage, right? There's noise around Medicare Advantage. I recognize that. That said, my client is the end user. And in their particular situation, which includes their health, which includes their financial resources, which includes the access to health care providers in that particular location, I sleep very, very well at night suggesting Plan X by Medicare carrier number 3. I simply do not have an issue if I believe that that is really the most suitable. You can see on YouTube lots of other hysteria. You can see it on Twitter or X, I guess you would call it, etc. You'll see other types of, mud balls being slung around. The reality is that none of that stuff matters to me because all I care about is the end user, the client. These types of allegations are serious. There's no question about that. The reality is if there's actually a criminal wrongdoing and they have a problem, there are going to be substitutes to fill the void. I am not concerned about the idea that other Medicare Advantage carriers could fulfill any void. That is not the issue. So what are you to do as a consumer? It's complicated. There's lots of noise. You're going to hear certain people say, well, I wouldn't touch this company. I wouldn't be a client of this company. I wouldn't go as far as that. I'm not going to be suggesting that. I would suggest, however, that coming into 2026, we're going to have new plans. Every year for a Medicare Advantage plan member, you have the unrestricted right to change plans. That was true then. That's true today. That'll be the true in the autumn. It has always been my idea, always, that people read a very specific book, published book actually, and in this book, what I'm basically saying is, look, you should check. You should check and defend yourself every single year. I've always stated this. Why? Because the moving parts move every year. That is the fundamental setup here. That's the way this works. This is annual contract. When I explain Medicare Advantage and Part D plans to consumers, as well as to professional and groups, including investment advisors, including other financial planners. I'm a certified financial planner. I've been very clear. I'm like, look, you want to understand Medicare Advantage, you want to understand Part D plans, you first understand annual contract. And the implication of annual contract means every single word can change every year. If anything here, what I would say is that these headlines here, if anything, they make it even more important. Why? Because there could be some adjustments here. We don't know. I'm not in the business of recklessly speculating. But what we do know is that Medicare Advantage plans, the risk scoring, this process of paying this extra allowance to Miss Kinda Sick or Miss Perfect, as well as Mr. Sick-a-Lot, who's legitimately Mr. Sick-a-Lot, that entire process and the way that the individual Medicare Advantage plans are given star ratings has become more difficult and is under scrutiny. The result of all of that is that in the autumn, when all the plans reshuffle, that I would expect even more dynamic reshuffling. Dynamic. How's that for a couched term, right? Meaning that I expect even bigger changes, more moving parts. And that doesn't not necessarily mean all negative, right? I understand that people want to resist change. I get all of that. But my point here is that the individual user, your individual user X in county number 37, the reality is is when all of these changes and all the language moves, you could actually be better off. And there could be some particular benefit. There could be some particular network change, which actually is to your benefit. And I'm overused the word, I realize that, but it may be in your favor. And you don't change just simply because I don't feel like changing. I wouldn't encourage that ever for Medicare people, the Medicare population. I'm going to be doubling and tripling down on that this year as a result of this. There are more, by the way, there are more reasons. And one of those is most favored nations. You can see here, and you can see fairly dramatic focus on healthcare cost planning, because for me, that is step number 1A on so many different levels when it comes to financial stability at households and financial planning for households, irrespective of your age. Which is that, for example, CVS Aetna is going to be pulling out of the ACA. You'll know that there's something called white collar recession. It's real. There's ageism. That's real. You're laid off for your job or you want to retire early, whether it be involuntary or voluntary, you're faced with COBRA. I made a tool. It's up there on the website. You can go to this location here. I created links on tools to deal with it. Super helpful for people from every walk of life. You could be somebody who wanted to become a social media influencer. You work at your company, you get the benefits. You work at, I don't know, Walmart. You work at Walmart, you're 29 years old. You say, I get these benefits, and I don't quit my job even though I could be the world's greatest TikToker. You don't, because you're worried about your loss of benefits. Well, the reality is you can figure out what that loss of benefit will cost to see whether or not that kind of career change can work for you. And the same thing especially true, you're 62. You're a few years from Medicare. You're not quite there. You have a spouse who's also 62. How are you going to get from 62 to 65? A very vital time, at a time that health insurance can be very expensive. Sometimes life circumstance will dictate it to you. My number one challenge on Jay's Corner is to actually create the correct set of indexes for you. Right? There's so many different topics. They clash. They interact with each other. And this is why I'm going to blame YouTube, even though it's probably my fault, right? Which is I'm terrible at making videos. I'm not a person who's inherently, naturally staring into a camera to make videos. It takes a long time to create them. You probably have heard this. One of the channels I follow that they're showing poker hands says hour a minute. I don't have an hour a minute. Anyway, what you have here is this interaction of a bunch of different topics, and you can see, and it comes to also, if you have the health care cost planning solid, then you can get to the other matters and what your investment savings strategy looks to be. That is obviously affected from headlines. And so I make comments on those headlines here. The decision making for you, for them, on how the dynamics change. How's this going to be resolved? Obviously too early to tell. Right? This is not going to be settled overnight. You're going to see headlines, denials. This will simmer down, I suspect, unless the Wall Street Journal or other locations continue to offer headlines and anecdotes. The anecdotes are out there. They really are. I've already made comments on a lot of them. here on Jay's Corner on Maximize Your Medicare channel, I've made lots of comments about the controversy around Medicare Advantage. To the buyer, it's just another reason to keep your eyes open. Buyer meaning the Medicare Advantage plan members. Today's not financial advice, and it's certainly not stock advice. We'll have to see about UnitedHealth Group, the stock. It's already down by more than 50%. The defenders are out there. The haters are out there. All I would encourage people is to do your diligence and think through these issues. Hopefully today's video has shed light on what this complicated article, a good article, don't get me wrong. Like I said, Wall Street Journal, credible source, obviously. But it's a complicated article about complicated topics. I'm trying to give you some idea on what those topics actually are and what they actually mean, how the mechanics actually work, and then how the end user, meaning the everyday public, everyday person who may be considering a Medicare Advantage plan or making these Medicare decisions, Medicare Advantage versus Medigap. We can have these different platitudes or different, complicated, academically driven kind of debates. To me, none of that stuff matters when it comes to our clients. We're there to fit the best configuration for the person, given their health and their financial resources and the location in which they live. Hopefully you liked today's video. Be sure to like, subscribe, tell someone else. I promise you that the things that I'm revealing, you know now. And especially thank you to those who have stayed to this point. I promise you, you are now in the minority, and other people should have this information.